Crucial 30 campaign. Check it out. Get involved.
Hello, 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 world. We are back again on a Tuesday evening to bring you content all over this world. Thank you, thank you, thank you for joining in. Tonight, we have some very special panelists. We are going to talk about the election from an important state, guys, from the viewpoint of healthcare. Backstage, I have some efficient and some brilliant doctors and healthcare advocates to come and discuss with you why your vote is important when it comes down to our health. Guys, we know that our health has been in a lens that is just different this year. Guys, it has been a year of all years. There would be no way in the world that at the beginning of 2020, when we cast and said, oh, we're going to have 2020 vision, I did not realize that a pandemic was in store. That is not just the only thing that we will talk about tonight. We will dive deep into why beyond the pandemic, this is important. So I am going to bring our panelists. I'm about to say candidates. Candidates, I hope you're tuning in. I am going to bring up our panelists one by one so that they can introduce themselves to you. Are you ready? Let's go. This is the Crucial 30, and we are the Narrative Shift. So up first, we are going to have Dr. Sylvia. Dr. Sylvia. Hello, Dr. Sylvia. How are you?
I'm awesome. Thank you so much for having me on. Great to be on the Narrative Shift. I love you guys' mission, and it's an honor to be here. Thank you.
I love it. Thank you so much for joining us. Dr. Sylvia, can you just tell us a little bit about yourself, your background, and what you practice?
Sure, absolutely. So my name is Dr. Sylvia Gonson-Bowley. I am a double board certified internal medicine and obesity medicine doctor. I like to say I'm a healthy lifestyle champion and great listener. And I have a passion for helping grown folks who are tired of struggling with their weight get to their happy, healthy weight for the rest of their lives through holistic and scientific methods. But outside of that, during the pandemic, I had been using my internal medicine skills by working part-time in a rehab facility that was hit by COVID-19. And so this year, as you said, has been illuminating because I think when I started medical practice 10 years ago, I could have never imagined that basically all the health disparities will come to a head in such a tremendous way like this. And so that's me in a nutshell. Outside of that, I'm a busy mom, I'm a runner, I'm a wife, I like to cook, I like to read, I like to have fun and do stuff like this and educate the public. So I
love it. I love it. Guys, did you hear what she just said? She is in weight loss and nutrition, especially in our communities. That is so essential. And so, of course, you're going to be able to get all of our panelists' information. If there's other things that they can share, you'll be able to go to our website and gain even more information on how they can help you in your journey as well. So, Dr. Sylvia, thank you so much. Next up is Dr. Katie. I will put you backstage and we'll see you soon. Dr. Katie, hi, how are you? Welcome.
Thank you so much. I'm so happy to be here tonight.
Yes, I love it. Welcome. Tell us a little bit about yourself, Dr. Katie.
Yeah, so I'm a primary care pediatrician. I work in Kansas City. My focus is especially on immigrant health, especially those from Latin America. And like Dr. Sylvia, I actually used to work in a weight management clinic for kids with obesity as well. I also have a big passion for kids with ADHD and behavioral concerns in general. I just love working with my patient population. I love teaching parents. It's a huge passion of mine. If I could just spend time with like newborn moms all day, that would make my life so happy. I also have a 1-year-old myself, and I just love spending time with her. It's the joy of my life.
I love it. I love it. And I know that you are really, you're just really passionate about just kids in general. I know last Thursday, guys, we talked about education. Well, education integrated with health, you know, that pure mix of just making sure that we're doing best for our kids. That's very important. And Dr. Katie is right here to tell us her accounts and expertise around those subjects. And so thank you so much, Dr. Katie. And I can't wait to dig in deep more.
Totally. Great to be here.
Dr. Carson is up next. Dr. Carson, I must say, I have to give a shout out, our fellow SSU Savannah State alumni is on the screen right now. Dr. Carson, tell us a little bit about yourself.
How you doing? How you doing? Thanks for having me. So I practice family and sports medicine. I'm in Baton Rouge, Louisiana. I practice mainly family medicine, but also do a lot of sports medicine with both of the local universities around at LSU and also Southern.
Are you there? All right, I'm going to have him come back down, and I'm going to bring in Alicia Cole real quick we're going to bring Donald back up. Promise, Dr. Carson back up. Alicia Cole, how are you? Can you tell us a little bit about yourself?
Yes. Well, and then we'll circle back with Dr. Donald because he's amazing, and I know you guys want to hear from him. Hi, everybody. I'm Alicia Cole. I am a patient safety advocate, and I work in healthcare across the spectrum. I work in healthcare policy. I work in trying to help pass laws across the country that help make healthcare delivery more safe for patients. And I work with patients and families who are in crisis and need help. And I've been doing a lot of that right now with COVID-19 going on. So many people looking for answers and looking for help and how to engage with the healthcare system and their providers in a way to get the best care they can and the best outcomes. But I'd like to say up front, a thing I do have to give a disclaimer on. I am a patient safety advocate, as I said, and I work in policy. I was appointed in 2015 by President Barack Obama to a Presidential Advisory Council on Combating Antibiotic-Resistant Bacteria. The PACCARB, say that 3 times fast. And so, we were all about advising at the executive level, the Food and Drug Administration, the Environmental Protection Agency, the CDC. I go to the CDC at least twice a year in their roundtable with advocates. And I did continue serving on that committee, that Presidential Advisory Committee, the last 2 years under President Trump. And in fact, I finished my service on that committee and got my handshake and my placard and all that good stuff the actual day that they announced the coronavirus task force in the next room. So I just needed to put out that disclaimer for those of you who know that I've worked in politics, and I want you to know it's been under both administrations. So the views that you will hear from me are my views as a patient and a person who has experienced healthcare. I am a survivor of multiple hospital-acquired infections, sepsis, Pseudomonas, MRSA, VRE, following a routine procedure to remove fibroids. And I've since had 9 surgeries, 11 blood transfusions, almost had my left leg amputated. I had an open abdomen for 3.5 years that had to be changed and packed twice a day, every day. I've had doctor's appointments almost every week for 11 years. So when I give my views, they're my personal views based on my engagement over a decade with healthcare. So thank you. Thank you for
that. And we know that you're a survivor, and we always send all the prayers and blessings to you. And so thank you so much. I'm going to put you backstage, Alicia, and then also bring back I'm sorry, guys. Dr. Donald Carson. I'm going to put you backstage. There you go.
I don't know what happened. I'm still at work, so I don't know. They probably didn't pay the internet bill or something.
Hey, don't say that. You can't say that out loud, Dr. Carson. Start over. Tell us a little bit about yourself. I don't think everyone's heard.
So I practice family and sports medicine here in Baton Rouge, Louisiana. My main practice is mostly in family medicine. I do some sports medicine as well, mainly working with some of the universities here in Baton Rouge. I'm just happy to be here. I like taking care of patients and trying to get the best out of my patients as most as I can. I have a 9-month-old, so that's my so that's my love of my life. So She's been fun to play with, and just like working out and having fun and enjoying the southern food down here. So.
I love it. I love it. I love it. Well, thank you so much for joining us. And like I said, I'm still going to give another plug because I didn't know if anybody, this is a Savannah State grad, guys, Savannah State grad, HBCUs all day. And so I'm going to bring everybody up so that we can get started in this crucial conversation. Are you guys ready? Awesome. All right. So your first question, I know I feel like I'm on like a game show or something, but we're not. This is serious. So, all right. So the first question that I just want to throw out there is, why is this election so crucial from a perspective of healthcare? And you guys can chime in and take the mic, but we really want to go deep. Why is this so important?
And I'll start on that from the patient perspective. And not even just the patient perspective. Choo-choo, I hear somebody's train going by. But I'll say this. This election, because of the pandemic and all that it has exposed in terms of health disparities, access to care, how pre-existing conditions can make you more vulnerable, social determinants of health, economics. This pandemic has ripped the rug up, just torn the rug up, and all the things that were swept under the rug are now to the forefront. And also with the Supreme Court about to make some decisions on the Affordable Care Act, whether or not to completely repeal it. And as of yet, we have nothing to replace it with. That means we will have 20, 30 million people in our country at the time of a pandemic with no access to healthcare that they can afford. And so this election is crucial and pivotal to healthcare for every single person in America.
Extremely well said, Alicia. That I totally agree. And kudos on you. You're such a survivor. I love to see, patients who have been through so much thriving and surviving after. So working in the rehab world is always nice to see on the other side of it. So, yeah.
Thank you. Thank you. Well, I've had the best of care, the worst of care, mediocre care. I've had every kind of treatment, from Reiki to hyperbaric oxygen chamber treatments to wound care, you name it. So a lot of wonderful things in our healthcare system that I would love for patients to be able to have access to, and to be able to get the care that they need in the area that they need it. A lot of people right now, I saw an article that said the number one thing that voters are concerned with at the start of the pandemic, it was healthcare. But now the economy is inching up on, number one in terms of things that people are concerned about. But I just want to throw this out. Medical debt and medical bills are the number one cause of bankruptcy in America. So when you talk healthcare, you're automatically talking economy and finances. You're automatically talking about how it affects. We're living in a pandemic, which is a public health emergency that literally shut down our country. So health drives economy. So you can't have a discussion in America about the economy without talking about healthcare.
Well, I think, as you said before, Alicia, and very eloquently, healthcare touches on every aspect of the election. So whether it's the social determinants of health, which for people who are outside of the healthcare, all that means is like your grocery store, your sidewalks, your lights, everything like that. I think as physicians, as doctors, we know that we can't have healthy patients if we don't have a healthy total environment, if their holistic life is not well. So I think that's part of everything. So whether we're talking about climate change, which, that affects healthcare as well, whether we're talking about the economy, that affects healthcare, and whether we're talking about medical debt, where we're talking about student loan debt, where that affects where, Dr. Katie is in primary care, people leaving primary care, medical students not going into primary care, so people cannot get doctors that look like them. So I think it's just so important for us to make sure that that you think about all of this when you're electing your next official. It's not even just about, do they support ACA or do they not support ACA? It's so much more far-reaching than that.
Absolutely. Yeah. And I mean, just to say that the patients that are the most vulnerable are often those that don't have their voice heard, whether they're just tied up with, like you said, medical debt or their own personal difficulties or social determinants of health that are impacting their lives. Often those are the patients that don't have the opportunities to get out and vote. So I really just want their voices to be heard this year. I want the people to influence the election, and so that we can actually have social change that will be able to like actually cause people to be healthy one day. I get so frustrated when we have policies in place that hinder our patients from being healthy, not because they don't want to, not because they're not trying, but just because there's so many obstacles in their way.
Yeah, I mean, you all said great points. I mean, everything you said, I was actually, thinking of. I mean, but just kind of talking about the economy and how important it is. You have people that are losing their jobs in the middle of a pandemic and also losing their insurance. So I've had a lot of patients that have come in with, a lot of comorbidities that don't have insurance anymore, or can't, or I haven't seen in a long time because they lost their job because of this pandemic and they're afraid of what's going to happen. So this election is very, very crucial to all of that. So it can, like I'm sure all the panelists, you can go into a whole lot more, but
Yeah.
it's crucial
Chelsea has more questions for us. So,
and another thing I'd like to also throw out in terms of economics, when we look at how the Affordable Care Act is trying to expand Medicaid, as opposed to take people off or say you can't get it if you don't work and that kind of thing. When we look at Medicaid and people, number one, say, well, where's that funding going to come from? Where's that? Well, here we get back to economics and we get back to tax breaks and tax cuts and how we have so many major, large mega corporations who pay no tax in our country. If those corporations did just their share, just 10% of their share, how many more Americans would have access to good health care because that money would be infused into the system to maintain and expand Medicare and Medicaid and keep it something that's secure for the future?
No, definitely. And I'm glad that you guys touched on so many different aspects, just thinking through the fact that you're talking about your economics being, impacted. You're talking about children being impacted. You're talking about even your access to food, being impacted, all based off of what? Your healthcare. And so when you go into, these, the ballot box and you really think about that, you have to really think about what candidates really care about the whole you. I'm in education and we always say, think about the whole child. And so when I give some advice, I say, hey, you know what candidate is thinking about the whole you, not just from a standpoint of just can you go to the doctor, but can you afford it as well. And so just thinking through just the way that we've had all these shifts, guys, many Americans, their main concern in the election right now has really been economics and healthcare. We're in the middle of a pandemic. People are losing their insurance, just like you said, Dr. Carson. And so how does that impact just the treatment? Let's go just a little bit deeper. How will voting help that overall?
Well, I was going to say, part of the affordable, we talked about student loan debt. Part of the Affordable Care Act was kind of incentivizing primary care. And primary care is pretty important. I mean, I'm biased because I'm a family physician, but it's important because you can catch a lot of the things before they become big problems. And that was the overall premise of basically incentivizing health, basically. In the beginning, a lot of physicians complained because of all these quality incentives that we had to reach, but you start to see the improvements from your overall patient's health, and in the back end, you were incentivized. So, part of the issue was trying to get more medical students basically into going into primary care because of these incentives, and to try to keep the burden down from people going in straight to the ER and things like that, because in the end, we see that patients are healthier when they're seen by their physicians regularly. And if they aren't able to see their physicians regularly, then you're going to have a problem, and you turn around and you have a burden on the system from them going into urgent or emergent care constantly.
And just to piggyback on that, Dr. Carson, I know that you're the only male out here. Can you just go into how important it is for our men? Women, we commonly get to the doctor and go to our annuals and stuff like that, but can you just give just a snippet? I know we're off, but I really need you to just hone in and just talk to our men real quick about how important it is.
My fellas, listen, you need to go to the doctor, period. Listen, I see guys come all the time, and they only come because their significant other, the wife or somebody sent them, and they think that they're afraid of what they may find. And I try to keep it as casual as possible with my guys. It's not the end of the world. And I tell people all the time, listen, it's better for me to find it early than to find something late. If I find it early, it's less pain, it's less whatever. We can take care of it. We can live our life. Don't come see me after everything's already kind of, crazy, because now you waited so long for no reason. So this is my favorite. This is what I tell people. They say they don't come to the doctor because I'm not sick. And I say, well, your car ain't breaking down on you, boy. You're going to get your oil change every 3 months, don't you? Mm-hmm. I just ask you to come see me once a year. That's it. Just come see me once a year. That's my only ask. You go take your car every 3 months to get the oil change. It's running just fine. But you're scared because it's going to break on you later on if you don't. Same thing with your body. If you don't come see me once a year and you let things add up, you're going to have that high hospital bill, medical bills that we talked about. So, your body is a machine. Once a year is all I ask. At least come see me, so that if something's creeping up around the corner, we can catch it a lot sooner. So,
yeah.
Fellas.
It's so funny you use the car analogy. That's what I was in primary care for 7 years. That's what I use for my men too. I'm like, come for your tune-up. It's like you get your little tune-up. I just pick you up. You can go on, run a little bit longer. Yeah.
I mean, if we're talking about doing things proactively, I can't help but put a plug-in out there for the flu vaccine. We got to do it this year. If any year, this is the year to do it. The hospitals are already full to the brim. We're turning people away already. You cannot afford to get the flu this year. Get your flu shot. It's not too late. Go get it.
I tell my patients that tell me no for flu shots, I say, you like to live dangerously in the time of Corona, don't you? Because I was like, you like to live on the edge, because this is not the flu shot, because it's just not. So
it's just that crucial. And I mean, and just thinking through, we've hit on the why. And so, but right now, what comes top of mind is the coronavirus, like COVID-19. That is what comes top to mind. But there's so much more that is happening in healthcare. There is the disabled. There's people that are living with special needs. There's mental health. There is obesity. There is diabetes. There are, chronic illnesses. And so, when we think about healthcare, how does your vote impact all of the other side of healthcare that's always been there before 2020?
There are so many policies in place that are directly affected by the government. I mean, I know personally as a pediatrician, programs like WIC and food stamps directly affect my patients' health. If my patients do not have access to those programs, I don't even know. They would not be where they're at. It's so important. And then education. So the schools, we need schools to be properly funded. We need good teachers in those schools so that kids can learn. They can have healthy environments. They can have access to school hot lunches. Policy.
School nurses.
Exactly. Yes. Good school nurses. Yes. Not just like the parent that comes in to help out, but like a true nurse in the schools. We need all access to healthcare that way too. The policy affects our children from day one, the day that they're born until the oldest guy that's living in the nursing home. Like everybody's affected by government policies. And so directly the people that you vote for are going to enact those policies. We have to vote for people who are going to support healthcare, to support access to healthcare. to support our children and access to food, to women and children. That program is so important. Oh my gosh, like so much education and so valuable. And to support education in the schools. Oh my gosh, like teaching children how to like cook for themselves, to learn about nutrition, to learn about how to keep their bodies healthy. I can't do it by myself. I need my teachers out there to do that for me too.
Yeah. And, you know, I'll just speak even from a patient perspective. I am a high-risk patient right now during this pandemic, and my mom is as well. She survived 5 strokes. She has a pacemaker. We are ride or die survivors in this family. But, you know, I'll just give you an example. I went in the hospital in 2006, and I got flesh-eating disease and all of that I mentioned before. I was in the hospital for 2 months. Now, this was prior to the Affordable Care Act. So at that time, most people were not aware that for your health insurance policy, whether it was with your employer or private purchase, healthcare policies had a $2 million lifetime maximum limit. So that if you had a catastrophic injury, you would find out after you got the injury that, oh, I've maxed out my health insurance. So that meant that in 2006, my hospital, the insurance company, I was a working actor at the time. And so Screen Actors Guild stepped in. Big ups to Ken Howard, who was the president of Screen Actors Guild at the time, who stepped in on my behalf. And Screen Actors Guild, through their Screen Actors Guild insurance, did a stop loss with my hospital, because 2 months into my hospital visit, stay, not visit, I was almost at $2 million. So that meant I would have left that hospital facing 3.5 years with an open abdomen that went from the middle of my left butt cheek over to the start of my right hip. Everything, it looked like a shark. It just snapped my midsection away. It took 3.5 years to close. And as I said, I had doctor's appointments every week for 11 years. Now, if I had left that hospital without my insurance interceding and doing a stop loss, I would have left that hospital maxed out of my lifetime maximum. I would have been one big giant pre-existing condition, which I already still am. But because of that, I would never have been able to get insurance again. I would not be here right now because I wouldn't have been able to afford the wound care, the home health care, the therapist, because of the depression and anxiety and fear and PTSD. So it's so important that we vote for someone who is going to keep protections for those pre-existing conditions and not just say it as a campaign slogan. And then when you look at what's before the Supreme Court, it wipes out everything. You can say you're going to protect it, but the actual black and white paperwork lawsuit that was filed wipes out everything. So we've got to protect the pre-existing condition. We've got to protect so that there are no longer any lifetime maximums. That was done away with through the Affordable Care Act. There's so many nuanced things that patients don't even realize they're being protected from.
Yeah.
I think another important thing too to think about, like you mentioned, is not just about getting access to the doctor, but being able to pay for the treatments that are prescribed. So I think twofold though. I think on one hand, I'd like to prevent having to even prescribe anything. So, what candidate is going to help us actually get those policies in place, like Dr. Katie said, that allow us to prevent disease? I would like to prevent obesity before it happens. I don't want to have to treat that. I don't want to have to treat diabetes, hypertension. Of course, if it comes up, yes, then we will. But if we can focus on what candidate is going to actually help us prevent some of these things by implementing access to healthy food, like we look at the USDA, like even from farm to table programs, and just like look at, so many things are intertwined in it. So that is so important. And then the other thing It's just that afterwards, when I prescribe medications, can you afford the medicines that I prescribe if you are ill? I mean, the cost of our drugs are astronomical, right? So both candidates have talked a little bit about how they're going to help with drug costs, but what's actually feasible, and when it comes down to fighting against the lobbying agents, like the big companies that fight to keep these drug costs high, which person is actually going to uphold preventing those costs from going up? So I think really we have to, again, thinking about the whole big picture about the prevention, and then afterwards the affordability for what I actually prescribe and the feasibility. Can you take sick time off of work? Like even can you get sick days? So when I say that you need to be off, for 7 days or 10 days to heal, like can you afford that? So it's so important.
Yeah, piggybacking on that, and Dr. Donald, like as a new parent, I mean, having paternity and maternity and parental leave for new parents, whether adoption, foster care, or like biological, we need that. Like it was crazy that as a doctor, I only got 3 months with my new baby, and it was a struggle. It was hard. That's a luxury. Like having 3 months was a luxury. Most people are lucky to get 2 weeks. So yeah, we need that.
And also, what candidate actually has a plan? That's what we have to look at. I mean,
we need a plan.
A lot of some candidates, but they don't actually have a plan. I think sometimes I don't. I know we're not endorsing any candidates, so I'm trying to stay on the line. But you have to, who has a plan? Who has a real plan to actually do something? Instead of just, taking things away without having anything to replace it.
Yeah,
and I would definitely say that, right now we are the narrative shift, and we do not, uphold the views of our panelists. However, we can put a charge out there. Candidates, where is your plan? You have in a debate this Thursday coming up on the national standpoint. The Senate is at large. The House of Representatives is at large. All of our local government is at large. So here at the narrative shift, I am asking you, where is your plan? All of your plans from everyone. So we're going to go ahead and put that out there. Sorry, Alicia, I just wanted to put that out there.
No,
charge out there.
Yeah, we do. We need to see the plan and not just talk about a plan. I mean, we've had 4 years of waiting for a plan that hasn't come yet. Let's just put that out there. And then also, there's talk about ways to lower drug costs. We can go to other countries and get our drugs. Here's my issue with that. I have a friend named Kim Whitsitt, who is a drug safety patient advocate. And she has an organization called Selling Sickness. And, and there's a book, there's an author, Rosemary, Rosemary, what's your last name? Anyway, Rosemary is a renowned expert on the drugs and things that we get from foreign countries. They don't have the same FDA criteria in place. We can't go into these factories in another country and say, how are you doing this? What's your processes? What are your procedures? And so to say that we can just go get our drugs from other countries, that doesn't solve the problem, because we want drugs that are affordable and safe. We want to know what's happening. I mean, you can't bash China on the one hand and call it the China flu, the China disease, but then say, oh, China, can you make our drugs for us?
Well, here's the thing with that. A lot of the generic medications that came, so a lot of the medical recalls from medications were generic medications from China. So I think there were some blood pressure medications that I think that were recalled. Everybody wanted to get off all of a sudden, but it wasn't the medication that was bad. It was where the medication was coming from. So, there is a cost with sometimes having, like you say, getting it from other countries because you don't know what they're doing. So, yeah.
And I think as we talk about, and we probably will bring this up later, but I think also people as informed voters, we need to go to their websites and look for their plans. We need to find unbiased news sources to find their plans, like Kaiser Family Foundation, go to the law schools. I can share some resources, because if you only get your information from a biased news source that tends to lean one way, you won't get a holistic picture about what's really going on and how is it really impacting me holistically. So I think that's another important thing too, because you're right, Alicia, as you said, people can say anything, right? But at the end of the day, there is a requirement. They have to at least put their platform up on their website. They have to, and there's been people who've done a lot of this research. So if you're busy, you don't have time to look, you can go to these sources that are nonpartisan and kind of just see and compare for yourself. Does this fit in line? What's true? What's not true? Rather than letting someone else digest it, add their own editorial, and tell you what to think. You can think for yourself and figure out if that's the right decision for you, your family, and for the country as a whole.
And Dr. Sylvia, that is so key. It's just do your own research. And then also don't think that just on November 3rd that your work is done. Your work is not done. You have to make sure that whoever you put in office or whoever gets in office, that they are still held accountable. We in the United States have an ability to speak our own truth. And we have to make sure that we start to handle and handle that truth with delicacy, but then also make sure that accountability is number one. Regardless of who gets in office, make sure that they do what they said they were going to do.
I'm glad. Go ahead. I'm sorry.
No, go ahead.
I'm glad you brought that up, because I think most people feel like, after they vote, that's it. They don't hold the candidates to accountable for what they said they're going to do. And I think most people in the United States fail to, forget that the power is to the people. Like, the people are in power. This is the people's government. So you do have a say in everything. It's not just vote on November 3rd or whenever election day is, but it's also about holding them accountable. You can call your senator, you can call your congressman. I mean, they're there to represent you, and so therefore you should hold them accountable for what they said they would do, and not let them off the hook.
And Dr. Don, I want to piggyback on that by saying, just as we're holding our elected officials accountable, we have to hold ourselves accountable too. Now, I'm about patient empowerment, and I'm about self-efficacy, meaning as a patient, you have to do what's right for yourself too. You can't have 35 years of smoking, drinking, drugs, partying, carousing, mistreating your body, and then show up and say, "Doctor, fix me," and get mad if they can't. So let's keep that real, okay? You have to be empowered as well. So that means being an informed voter, but that means after this major election, like Dr. Donald said, holding people accountable. But how can you hold yourself accountable? Are you in the PTA? Do you go to school board meetings so that you can say, we need a nurse at my child's school? How come I grew up with a nurse at our school, but we don't have those anymore? We want to get nursing back in the schools for these kids instead of just, sending them home. And then do you monitor the medical board meetings in your area? Are you engaged? Do you go and listen and see what they're talking about and what standards are they holding the medical community to? What about the health department in your area? Do you go to some of their public forums and educational forums so that you can find out what's going on in public health in your area? Get engaged, get involved. This is everybody's country, and we all have to play our part. You can't just vote for someone and then sit back and say, okay, fix it. No, you have to get engaged as well and join the army and be about changing your local area and getting involved and letting them see you be active. Can't go back in a hole and come out once every 4 years and vote and think that's going to make a difference.
And I love that so much, because I will have to say that here at the Narrative Shift, people think that we are a political organization. We're not. We're a nonprofit that focuses on 4 different areas, and this just happens to be one of the crucial campaigns that we will put on. So when we say get involved, it means beyond just the election, just like Alicia said. And so when we think about, we've talked about our younger babies. We talked about our babies that are under the age of 18. And I think I'm a little bit older to say that my college students are also my babies too, because I'm old enough to have a college student. That's crazy to say that. However, when we think about just the fact that our college students, when it comes down to food deserts, when it comes down to healthcare and being able to stay on their parents' healthcare until the age of 26, let's talk about that just a little bit, and how is our vote going to impact that?
Yes, I mean, the Affordable Care Act opened up huge doors. It bridged a huge gap. College kids were notoriously bad at going to the doctor and getting continuity of care. So the ability for them to see me until they're done with college, if not a few years longer, I mean, I'll kick you out after 22, but it's been so important. So just that access, having availability of like knowing where to go to the health department, to go to your pediatrician. And like you guys said, I mean, I cannot reiterate it enough. Like, your vote on November 3rd is crucial, but continuing that involvement afterwards, calling your senators, calling your elected health representatives, all of them are so important. And then, but as you said, Alicia, I think you really nailed it. Like, you guys are responsible too. Like, I can't tell you how many times I will give education and then nothing happens. And so this is so crucial. But like you said, like, access is so important. Getting the ACA to have coverage for all is so important. Providing that empowerment for our patients to know that they can go to the doctor to ask us questions is so important. But then I think Dr. Don really hit on this too, is also empowering our physicians and our medical community too. Medical school is enormously expensive. There's such a hindrance. We need more healthcare professionals out there in order to educate the population. We need new school nurses. We need more doctors out there. We need nurse practitioners. We need care assistants. We need nurses. So we need more money in that as well, and more funding and more education about the whole system needs just to be fixed. Let's go out and vote and just make a difference for real.
Yeah.
Awesome. And so I know that, I want to respect everyone's time. However, I want to be able to just throw out there, what words of wisdom as we wrap up do each of you want to give to the world? Because I will say that the majority of our audience watches after our broadcast. And when they're replaying this back, what are the last words that you want them to have on their minds?
I think I saw something come across the screen earlier. Health is wealth. And you can look at it from all aspects of in voting. Me personally, kind of what I said earlier, guys, is talking to the men, you got to take care of yourself. Even to the women, make sure you're taking your going to your regular appointments, taking your medications as prescribed, not taking it just when you feel bad. That's like one of my pet peeves. And just overall taking care of yourself, kind of like the other panelist said. I would rather not prescribe anything. I'd rather you be a lot more healthier, because when you are healthier, a lot of these issues take care of themselves, and we don't have to prescribe anything. My best appointment is the one that I don't have to do anything, and it's just the hey and the bye. It's like, how you doing? Everything looks good. Everything's great. Your numbers look great. See you next year. So I'm not in the business of just writing a bunch of scripts so you can go and spend a bunch of money. So health is wealth. Take care of yourself, and that's what I would want to do.
Yeah. And I would piggyback on that and say, we would love for every patient to be able to go in and get checked out. Medicare right now has their wellness visit exam for seniors every year. If you're on Medicare, you go in, they meet with you, you do tests, all of those things. You get your gauges checked, like the car analogy said, but you also want the system in place for if they find something wrong. Their hands are not tied. A physician can do what they need to do to make their patient whole and healthy so that you can get back out and have a full life. And that means empowering our physicians, empowering our systems, but also putting checks and balances in place with where our drugs are coming from and the prices on the drugs, and making sure that people can afford healthcare policies, their insurance and those kinds of things, and making sure that the social determinants of health, we need food, we need grocery stores in urban communities where people have to catch the bus to go to the grocery store, or there's no medical facility in their neighborhood, and it hasn't been there traditionally because of redlining in the past. And so, an older woman has to take 2 buses to get to her doctor's appointment. She may or may not show up, So healthcare involves everything, and we really have to take ownership of our part. Are we voting, with a good base of knowledge? And then are we following up on that? And are we getting engaged and helping out? So, the power is in your hands. Don't think that your vote doesn't count. I don't know if this is true or not, but I was told years ago that my high school, Admiral King, was built, the levee passed by 1 vote. Now that's what we were told. And that always stuck with me. And so when I was 18, it was time to start voting. I took it very, very seriously. And I haven't missed an election since then because I know the power of that vote. And so people, you got to remember that for years, people fought and died to be able to have that right to vote. And the reason people tried to keep them from voting is because they know how much power is in that vote. So you have to look at that. If someone's trying to keep you from doing something, it must be pretty powerful. So use your power, use your voice, vote, and vote wisely.
You're on mute, Dr. Katie. There you go.
I had a baby in the background, so sorry. I was saying you guys are so well spoken. I have almost nothing to add. But just vote for those who are on the periphery. Vote for those who don't have access to food. Vote for those children who are stuck at home right now, struggling online with education. Vote for the elderly in the nursing homes right now. Vote for my immigrants. Vote for the immigrants at the border. Vote for those of color. Vote for anybody that is not yourself. Vote for your mom. Vote for your dad. Vote for those who fought for the vote for so many years. We owe it to them to go out and vote. Get your absentee ballot if you haven't already. Then go out and vote. It is worth it. It's worth every single cent because we need to change policy. We need to get people health care. It's not a question. It is a right. It's a necessity. Just go vote.
No, definitely.
Well, everybody said everything so well. But I just want to close by saying you matter and your vote matters. You matter and your vote matters. So a lot of times people say, well, I don't like any of the candidates. This wasn't the person I wanted to go through. But at the end of the day, when you go to the fridge and you don't have something you like to eat in your fridge, you still pick something to eat, right? So it's the same thing. You got to make a decision. It may not be perfect, but I think for every reason that everyone has said, there's something that positive that can come out of the decision that you made to vote. And so don't give up your vote. People have died for it. People have fought for it. There are people who can't get out there and do it. So make a decision and vote. And when we talk about health care, we really want to build a system that cares about you and not just part of you, but the whole you. So right now, we don't necessarily have health care. We have health repair, health fix, real quick, health patch. But we want to have a system that cares about the whole person and the whole being. And that can only happen if we start at the base level of voting, and then, as Ms. Alicia said, continuing doing something. And it doesn't have to be everything. You may say, I'm busy, I'm working, I don't think I can go to PTA meetings, I don't think I can call my senator, but do that small thing that you can do. You may say, I'm busy, I don't think I can exercise 2.5 hours a week. Do that small thing you can do. Do a minute. Eat that apple instead of that bag of chips. So do the small thing you can do, but you matter, your vote matters. So make it count on November 3rd, guys.
I just want to say one more thing too. She said even if people that don't vote because they don't like a candidate, remember also the election day is not just about those 2 candidates. It's also local elections that have probably the bigger impact. So just remember, it's not just about 2 candidates. When you go vote, it's about more than that. It's about your local elections as well, and those will directly affect you, probably a lot more than your election. So
Guys, you have heard it from our panelists of healthcare officials and advocates. You have heard so much detailed information, and I just want to thank each and every one of you on this panel tonight because you have truly helped change the narrative. Thank you, thank you, thank you. And so we just want to just say, guys, your vote counts. Healthcare matters. We need to be able to follow up and make sure that we understand that all of these things are integrated together to make sure that we care about who? About you, about us, about the next generation, guys. Your vote counts, and don't let anyone else tell you differently. So, guys, just with that said, we are just really, really privileged here at the Narrative Shift to have such a great network and great partners. And again, we thank you, thank you, thank you. We will be right back here on Thursday evening with another great group of individuals talking about why the election is so important from a financial standpoint. Guys, if you care about money, if you care about what's in your pockets, if you care about wealth, then you do not want to miss this important discussion around why our vote matters to our pockets, guys. Between now and then, tomorrow we will have our prayers for our nations from all faiths, and tune in for that. And then, of course, we'll have our blogs and a special, special tribute this Saturday for our Motivation Saturday, guys. Guys, this is the Crucial 30 days of content. Guys, people thought I was crazy when I said our team is going to do 30 full straight days, but it's that crucial and it's that important, and your vote matters. And so with that said, we love you all, and we hope that you reshare this, repost it, and thank you, thank you, thank you.
Thank you. Thanks, Chelsea. Good job.
Yes, definitely. So that is it.
The Crucial 30. The Crucial 30.
The Crucial 30.
The Crucial 30.
The Crucial 30.
The Crucial 30.
It's the Crucial 30.
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 It's the Crucial 30. Well, I know you can do it.